So the burden of valvular heart disease, and as you can see here, these are the two major heart valves that we're going to talk about. You can see overall in green, but then mitral and aortic valve. And you can see that those are actually very prevalent, and unfortunately the older we get, the more prevalent these valve diseases can be. And the sad part is that some people don't even know about it, right, because they haven't been diagnosed yet. But an estimate is probably this 5 million people have valvular heart disease overall in the United States. Cancer is often, thought to be a very bad disease, right? So the truth is actually the valvular heart disease is more dangerous than these cancers. It is a big problem, and yet in some instances, compared to certain cancers, we can actually treat valvular heart disease quite well. The sad part about it is we know it's very deadly, but not everybody gets treated. So if you look at this chart here, 10 figurines on it, less than 1/3 of the patients still, this is 2020, maybe now we're at 40%, but less than 1/3 of the patients get actually treated for valvular heart disease. But the prognosis is like cancer, and in some instances even worse than cancer for valvular heart disease. And we have a lot of effective treatments for valvular heart disease. Unfortunately, although we have all of this, the prognosis and the effectiveness, most of the patients unfortunately don't get treated, so we have to work on that. And then in addition to that, most of the patients don't even know that they have a problem, right? So that's why we're here. We want to teach you. You can teach others then. Yeah? If you have, for example, shortness of breath, someone in your family has shortness of breath, it's not just the age often, right? So have them go to the primary care physician, have them check out, and maybe they need further workup, which might include tests that we're going to discuss today. One of them is an echocardiogram.